Welcome all. We are so glad that you've joined us today to talk about School-Based Health Center Startup. A few reminders before we begin. All attendees are in listen-only mode. To ask a question during the session, please use the Q&A function. If we don't get to your question, please feel free to email us at info@sbhforall.org. That email address will be linked in the slides. Closed captioning is enabled for this session. To turn it on, you can click the CC button on your Zoom control panel. At the end of the session, we'll invite you to complete an evaluation poll. Your responses are important for helping us improve our work. And finally, the slides and recording from today's webinar will be available on our website, and we'll email those materials to attendees. Our hope is that by the end of our time together today, you'll be able to describe the national landscape of school-based health centers, describe how school-based health centers differ from community-located pediatric healthcare models, that you'll be able to identify at least 3 key considerations for school-based health center planning, and that you'll be able to identify opportunities and resources available from us, the National School-Based Health Alliance, to support your school-based health center planning and implementation. To meet those objectives, we'll talk a little bit about the national landscape of SBHCs, including sharing findings from our national census of school-based health centers. We'll discuss the framework for excellence and sustainability in school-based health centers, which includes the core competencies and nuts and bolts of sustainability. As we discuss the nuts and bolts, we will share some practical considerations and ideas related to SBHC planning and implementation. We will touch briefly on state-level resources and federal funding, and then we'll spend the last bit of our time together this afternoon highlighting resources from the School-Based Health Alliance to support your work. My name is Emily Baldy. I'm delighted to be joined today by my colleagues Shamika Davis and Paula Fields. We are also fortunate to have some additional colleagues who will join us briefly to share about resources and supports available to you. Before I turn it to Paula to share more about our work, we would love to get a sense of who is on the call. I'm going to launch 2 Zoom polls. The first asks you to share which option best describes your organization. We'll take a moment to let folks answer. Thank you. This is really helpful. So this is probably about what we would expect, a mix of healthcare orgs, schools and school districts, and nonprofits, and then a handful of people from research and policy. We're so glad that all of you have made it today. The next poll will ask you about your connection to school-based health centers, and we would encourage you to choose multiple results if more than one of the options applies to you. Here we go. So this ranges from we're just exploring school-based health centers to I work in a school-based health center and everything in between. Thank you all. It looks like there are some folks who are exploring, a good number who are planning. About 7% of you on the call work at a school with a school-based health center, exciting. And then there's a good chunk that says their organization supports the work of school-based health centers. I'm going to end the poll and share the results in case you're curious about who else is here. All right, I'm going to turn it to Paula to share a little bit more about the School-Based Health Alliance.
Thank you, Emily. I am so excited to be here and talk about how to support students through school-based health centers. As a nurse, mom, Mimi, past administrator and federally qualified health center board member with over 25 years experience in the field, I remain a fierce advocate for school-based health centers because I've seen what it makes possible for students, families, schools, communities, including my own kids. To get us started, we want to share a bit about who we are. And we are a DC-based nonprofit. We were founded in 1995, and we serve as the national voice for school-based healthcare. Our board of directors includes vast representation from leaders across the nation, such as school-based health center administrators, including health centers and hospitals, state leaders, including school-based health alliance affiliates, primary care associations, national organizations, including the National Association of Community Health Centers, the National Center for School Mental Health, school staff, representing national associations for superintendents, school nurses, counselors, social workers, psychologists, managed care, philanthropy, community schools, and last but not least, youth. The reason I am here is we believe that all children and adolescents deserve to thrive, but too many struggle because they lack equitable access to healthcare services. School-based healthcare is one solution by bringing that healthcare to where the students typically spend a lot of their time at school. Our focus includes policy, standards, data, training like today, technical assistance, and consulting to support your work. We are excited to welcome the 77 newly funded school-based service expansion grantees and others. Thank you for your work and dedication and what it makes possible in supporting students' success. Now I would like to turn it over to my colleague, Shamika.
Thank you, Paula, and good afternoon, everyone. My name is Shamika Davis, and I'm excited to start this presentation today with looking at what is School-Based Health Center 101. And in doing that, we are going to go over what is school-based health services, what is school-based health care, and health equity. So when thinking about health equity, one may think of, well, what is health equity? How does health equity arise? And how can school-based health centers address health equity? Well, health equity arises from access to the social determinants of health, specifically from wealth, power, and prestige. The social determinants of health have a major impact on an individual's health, well-being, and their quality of life. Individuals who have consistently been deprived of these three determinants are significantly disadvantaged from health inequities and face worse health outcomes than those who are able to access certain resources. So health equity is defined by the Robert Wood Johnson Foundation as everyone having a fair and just opportunity to be as healthy as possible. So school-based health centers advance health equity as they respond to the individual, school, and community needs. We can get everyone health care, but if it isn't geared towards specific needs, culturally and age appropriate, then the impact of the services will not result in the best outcomes. So it is not equity to simply provide every individual with the same resources, as is shown here from the illustration by the Robert Wood Johnson Foundation. That is equality. In order to achieve health equity, resources must be allocated based on an individual need-based principle. Over the next two slides, we are going to look at what are school health services and what is school-based health care. School health services include, but are not limited to, school nursing, school counseling, school psychology, and school social work services that support student health. The usual governing entity of school health services is the local education agency. The legal authority governing the health data and privacy is the Family Educational Rights and Privacy Act, also known as FERPA. School-based health care is provided through school and community health organization partnerships and in collaboration with school administration and health services staff. This care includes, but is not limited to, primary care, mental health, oral health, and vision services. This care complements, it does not replace or duplicate existing school health services. In school-based healthcare, the usual governing entity of school-based healthcare is a community healthcare organization. And the legal authority governing the health data and privacy is the Health Insurance Portability and Accountability Act, also known as HIPAA. In your registration, we received a question regarding what are some ways we can begin in servicing the students if construction of the school-based health center is 100% completed. Some ways include that, one, we know that school-based health centers aren't always possible, but in those cases, healthcare organizations can partner with schools on things like health fairs, health education, and also pop-up clinics. Next, we are going to look more into school-based healthcare. So we are often asked about specific services such as parental consent, scope of services, and how school-based health centers work with existing services such as primary care providers and school nurses. Some common questions we get with community-provided school-based healthcare include around consent. So with consent, parent-guardian consent is required for care. Available services are not provided without permission except as allowed by state minor consent law. Importantly, school-based health centers do not necessarily provide services for which minors can consent under state laws. Next, around confidentiality, knowing that confidentiality laws differ across states. And in terms of scope of services, services are determined at the local level in accordance with state and local policies and/or law. And then for existing services, to remember that these do not replace required school health services for free appropriate public education, also known as FAPE, but instead it supports and enhances. School-based health centers do not replace parents and guardians, school nurses, school counselors, pediatricians, or other existing services. So it is important to recognize that parents, guardians, educators, and healthcare workers all want the best for children and adolescents, and building partnerships is the first step. I would now like to highlight the Community Guide and the Community Preventive Services Task Force, which was established to develop guidance on which community-based health promotion and disease prevention interventions work and which do not work based on available scientific evidence. The task force findings are shared through the Community Guide. In reference to the Community Preventive Service Task Force, there are two key school-based health center findings. The first is around health equity. So with school-based health centers, it recommends that the implementation and maintenance of school-based health centers in low-income communities are needed to improve educational and health outcomes. And then the next key finding is around cost savings. And with cost savings, the economic benefit of school-based health centers exceeded the intervention operation cost. And further, school-based health centers were related to the net savings to Medicaid. I'll now hand it over to Catherine.
Thanks, Shamika. I'm excited to kind of move on from that data aspect to talk a little bit more about SBHA's data role. As you heard earlier, one of our roles as an organization is in data collection, analysis, and dissemination to support the field. And one of the ways we do this is through our national census of school-based health centers. SBHA has conducted the national census of school-based health centers, or as you'll hear us call it, just the census, because otherwise that just gets too much of a mouthful, for more than 20 years, capturing the growth and evolution of SBHCs nationwide. As SBHA advocates for national policy and legislative action, we use the findings from the census to tell the story of how SBHCs are offering or making care available to students across the country. The census helps us tell people how SBHCs are funded, how they are staffed, how long they've been open, and how they're meeting the needs of their communities. And you'll hear me stressing how throughout this. That's because the census only tells part of the SBHC story, specifically in what options are available to students. And to get a better understanding of what the impact SBHCs have, we have to look at what services students are actually receiving or the uptake. And we'll talk about that a little bit later in this presentation. And with that, I'll throw it back over to Emily.
Thank you, Catherine. I have the privilege of talking this afternoon about some key learnings from our census. It's important to know that the final sample from our 2022 census included 1,518 school-based health centers from more than 500 sponsoring organizations across 47 states and the District of Columbia. That accounts for about 40% of the roughly 3,900 school-based health centers nationwide that are known to our team. In a moment, Shamika will talk about sponsors, but when we say sponsor or sponsoring organization, we mean the entity who is providing healthcare services at the school-based health center. Typically, this is a healthcare organization. All right, I'm going to share some highlights from our findings. Our intention here is to help you situate your work within the national context. If you'd like to learn more about any of these findings, or if you're interested in some additional information, please see our census report. It's linked in the slides, but I'll also drop a link in the chat in a moment. Most school-based health centers, 92%, operate via a traditional model, which means offering care from a fixed location on a school campus. This model may include telehealth for some services. In fact, 90% of school-based health centers report using telehealth for some services. You can learn more about this in our census report. We won't be talking in depth today about delivery models, but if you're interested in telehealth, as I know some of the folks on the call are, you might find our telehealth playbook helpful. It's also linked in the slides, so you'll receive it and follow up. Most school-based health centers, 82%, offer primary care, behavioral health, and expanded services. Expanded services can mean oral health, vision or nutrition services, care coordination, health educators, or outreach services. And when we say primary care today, we're talking about the kind of medical care that a child would get at their pediatrician's office. So that might mean preventive care, management of chronic conditions as appropriate, and acute care. In terms of primary care staffing, nurse practitioners are the most commonly reported primary care provider type. School-based health centers rely on a diversity of funding sources. We got some questions about this. Most bill insurance, and Paula will talk in greater detail about this later on. Finally, health centers, also called federally qualified health centers, community health centers, are the most common sponsor type, followed by hospitals, then health departments, school districts, and other sponsor types. I'm going to drop those links in the chat for you and turn it to Shamika to talk a little bit more about school-based health centers and how they're unique.
Thank you, Emily. We're now going to look at how school-based health centers differ from community-located pediatric healthcare models and also responsibilities. So some of the similarities between federally qualified health centers and school-based health centers include focusing on serving children and adolescents, schools are a key partner, and also in the mission, vision, and also in increasing access to care. A difference includes allowing productivity variance to take into the need of staff time for outreach and engagement in the school-based health center. As we've shared, a school-based health center is a shared commitment among a healthcare provider, a school, and a community. So now I'm going to highlight some of the common health sponsor responsibilities. And when we say health sponsors, we mean the entity who employs the staff that provide health services at the school-based health center. Some of the common health sponsor responsibilities include to manage the consent process for the school-based health center, to employ, supervise, and credential school-based health center staff, to provide health information technology infrastructure, to drive quality improvement, and also to conduct outreach for the school-based health center. The school has a critical responsibility in a school-based health center. The common responsibility of schools include to provide a space for the school-based health center, to serve as a liaison with the school-based health center, and also to lead or be a member of the planning group or advisory committee. So it is important to note that these slides reflect what we typically see in terms of the roles and responsibilities. But we know that in some communities, the school takes on additional responsibilities. For example, sometimes there is a person on staff at the school who has the capacity and relationship to take the lead on facilitating the planning group or the advisory committee. And next, we're going to look at the role of a school-based health center provider and how it differs from that of a provider in the community. So school-based health center providers need the desire, skill, and time for relationship building with students, school staff, and community partners. Also, to be flexible, to be comfortable with including parents in visits virtually, to complete follow-up care with parents as necessary, and also to keep in mind that the school-based health center provider role may include more consultation, crisis intervention, school wellness related activities, and building partnerships with school staffs. And in hiring a school-based health center provider, it is important to make sure that the provider is able to build trusting relationships with students and their families. Paula?
Thank you, Shamika. Whenever we move to the next slide, we talk about the framework for excellence and sustainability. The National School-Based Health Alliance partnered with the school-based health center community, including some of your peers, state leaders, experts from the field, and really combed through the literature and research. This knowledge resulted in the development of two fundamental guiding documents, core competencies and nuts and bolts. And as we go over each of these, I really challenge you to think about how you can use these when you're planting, implementing, and sustaining, as well as for quality improvement of your school-based health center in how you are supporting students. Although there may be some differences in how school-based health centers look depending on their setting, such as elementary schools differ from high schools, the fundamentals remain the same. So let's take a bit of a deeper dive into the school-based health center core competencies. They were originally created in an effort to provide guidance to the school-based health center field. And on the screen, you'll see 7 core competencies representing the knowledge, expertise, policies, practices, and attributes that every school-based health center should strive for in its pursuit of student wellness. School-based health center staff and administrators can use these to achieve excellence in delivering care in a school setting. Next, let's do a bit of a deeper dive into the nuts and bolts of sustainability in school-based health centers. The 3 domains are represented as kind of like cogs and include strong partnerships, sound business model, and high-quality practice. And similar to a machine, if one of these aspects of sustainability isn't working to its fullest potential, then it will affect the overall sustainability of the entire school-based health center program and impact for students. Shamika described earlier that school-based health centers are a unique model of care, and I'm going to emphasize again how important it is to recognize that working at the intersection of health and education creates unique situations that likely aren't present in other models of care, even though they're different in that aspect from a community health center. So it's really important to understand the nuances of school-based health centers' sustainability. And we have many tools that are designed to support sound business and high-quality practices, and we'll share those in the slides when you receive a copy. And now we're going to transition back to Shamika to do a deeper dive into the nuts and bolts.
Thank you, Paula. The first domain we'll talk about is partnerships. So we're going to spend the most time talking about this cog because it is so critical. Sustainable school-based health centers develop and nurture partnerships with school and community stakeholders such as sponsorship organizations, local healthcare provider, students, and families. This is not an exhaustive list of stakeholders, but they are priorities to engage. So I'd like to provide an example of how a partnership can drive sustainability. The example is about the empty waiting room. Successful school-based health centers develop strong partnerships with school personnel, yet there are still empty school-based health center waiting rooms. Just because a school-based health center is built in a school does not mean that students will come. School administration staff can distribute and collect consent forms to enroll students in the center, and also teachers are the greatest allies in marketing and referring students to the health center. Without enough student enrollment or utilization, the school-based health center will not be able to generate enough visits to remain sustainable. So now we're going to look at core partnerships and focus on one specific core partnership, which is between schools and health sponsors. So as we highlight and talk about nurturing and developing partnerships, we will begin to focus on working across education and health. So some tips include to keep it simple, to speak in health and learning language priorities, and also to have a common understanding of words. One example is school health. What school health means in the health sector does not necessarily mean that school health means the same thing in the education sector. Also, with the ABCs. With the ABCs of medicine versus the ABCs of education. If you are to go by the old CPR term of ABC, that can mean airway, breathing, and circulation. But if you ask someone in the education sector, what does ABC mean? That can mean attendance, behavior, and course progression. So it's important to have a common understanding and language of terms that is used between the health and education sectors. Also, education uses data in different ways from the health sector. The education sector focuses on data such as attendance, demographics, grades, schedules, and assessments. So when sharing health-related data, stick to less, which is more. You can focus on data that makes connection with priorities of the schools and find ways that you can connect the health data with learning, academic achievement, and attendance. So understanding the role of the school health provider in your school. So in building this partnership, it's important to understand the provider's role. Some questions that one may consider asking is, well, can you tell me about your role and what does a typical day look like? What does it involve? Who do you see? Are you seeing all the students or are you only seeing a specific population? And how are the students connected with you? What are the outreach methods that you are using to engage the students? And an additional way to strengthen partnerships for both the health sponsors and also the school sponsors are that the health sponsors can sponsor a welcome breakfast for school staff to get to know the school staff, to learn more about them, and also to describe the services that they will be providing, to collaborate with teachers on health education lessons. And the school partners can visit the school-based health center to learn more about the services that are offered and also to participate in any feedback opportunities that are offered by the health sponsor.
Thanks, Shamika. Now that we've talked a little bit about partnerships between health sponsors and schools, I'm going to talk about partnerships between school-based health centers and parents and guardians, as well as school-based health centers and young people. We'll talk first about partnering with parents and guardians during the planning process. And then on the next slide, we'll talk about how school-based health centers work to ensure that parents are involved in their child's care. In terms of the planning process, when we say begin with intentionality, we mean get explicit about how students and parents will benefit from parents' participation in school-based health center planning. Offer options for how parents can ask questions, share insights, voice concerns, and offer input. Some examples might be focus groups, surveys, town halls, informal opportunities for parents and guardians to meet the school-based health center planning team or providers. I'm sure that you all also have a lot of insight about the best ways to reach the families that you serve. Invite parents into the process. Consider who on the school-based health center planning team might have the capacity to lead parental engagement. Where might you begin your outreach? You could put out an open call, connect with existing parent groups, or work to connect with parents at school events. And then consider which groups you might not reach through these methods. Work with school staff, health staff, and community leaders to identify other routes to reach a wider swath of parents. If you are going to ask community leaders, school staff, others to help you engage parents, consider who are trusted messengers and how can you equip those messengers with concise, accurate information about the school-based health center planning process. Finally, as you plan for inviting parents in, it's important to consider how to engage parents who have concerns about school-based health centers. SBHCs are not immune from conversations about the roles of schools and community partners in addressing children's health needs. And then plan for productive and meaningful collaboration. Be clear about decision-making processes so parents and guardians understand how their insights will impact the planning process. I know you know this, but schedule meetings at convenient times with a focus on making it as easy as possible to participate. Does that mean providing a meal, helping people arrange transportation, ensuring language access? Plan for strong facilitation that is mindful of power dynamics, especially in a group of mixed stakeholders. How can the facilitator run the meeting so that there truly is space for parents to express their thoughts? It's important to keep in mind that the parents who join you in this process don't speak for all parents. Finally, consider whether it's fruitful to have a parent and guardian planning group, or whether parents and guardians should be included in a larger planning group, or whether a hybrid of both approaches makes the most sense. Once the school-based health center is offering services, it's critically important to plan for how the center will partner with parents in their children's care. That means having clear policies and procedures related to consent, confidentiality, which services are offered, and how billing will work. Additionally, school-based health centers should outline the procedures for parents to participate in visits, whether that's virtually or in person. They should also have clear protocols for communicating with parents before, during, and after visits. Details about all of those things should be messaged in a way that's clear and accessible to families. Shamika talked about how school-based health centers complement but don't replace a child's other health supports. If the child has a primary care provider, it's important that the SBHC coordinates and collaborates with that person. There have been a handful of times as we've talked that I've thought, ooh, that's in the core competencies. We'll be sure to share those in follow-up, but there's additional information about partnerships, about coordinating with community providers in those core competencies. All right. The next relationship and partnership we'll talk about is partnering with young people. Our colleagues at the School-Based Health Alliance, Selena Moore and Harper Byers, lead SBHA's youth development work. Selena will share more about that work shortly, but as we head into this section, it's important to know that this is an overview intended to spark your thinking about how you might partner with young people. When we talk about this partnership, we're talking about creating opportunities for youth to inform the work and, where possible, to lead some aspects of the work. Ideally, partnership with young people in the school-based health center planning and improvement process benefits the SBHC by making it more responsive to the needs of its patients, and it benefits youth by helping them learn and grow in areas that are important to them. Planning for partnerships with young people starts with the mindset that we are all youth workers. For some, this might be an affirmation. For others, it might be a shift. Every one of you on the call is a youth worker, whether or not you work directly with youth. All the work you're doing related to school-based health centers is about young people's health. This mindset asks us to consider, what role do we play in seeing and supporting young people as partners in this work? How do we help them develop and advance their skills and assets? On the next slide, we'll talk about considerations for fruitful partnerships, but for now, here are some ideas of how you might partner with young people. They can be involved in school-based health center planning, implementation, and expansion. They can also partner with the school-based health center in an ongoing way to work on health-related issues that are important to them. Some options include a youth advisory council, serving as a member of the larger school-based health center planning group, providing feedback on school-based health center services, collaborating on outreach for the SBHC, providing peer education and mentoring, and working on asset mapping and needs assessment. Some SBHCs support young people who are interested in the health professions by offering internships and shadowing. Other school-based health centers work with young people to do advocacy related either to school-based health centers or to health issues that matter to them. In each of these examples, the goal is to better meet the health needs and life goals of students by incorporating their insight, supporting their growth and development, and making space for them to lead. Much of what we'll share on this slide mirrors what we've talked about for partnering with parents. It's important to determine the purpose of engaging youth in any aspect of this work. Consider developing a vision and mission for your youth development as part of your larger work. For example, our organization has a vision and mission that guides our large work, and we have a related vision and mission for our youth development work. To cultivate relationships, start with the young people you're already connected to. Think about who are some trusted adults that might be involved in this process. A coach, a school secretary, a beloved teacher. Work with them to identify students. If a student is interested in participating in the School-Based Health Center's youth development work, invite them to bring a friend. Set clear expectations. What kinds of decision-making power will youth have? What are you asking them to commit to? Will they decide which issues to address, or are the projects already decided? Communicate frequently and know that young people may have different preferences for communicating than adults. For example, they may be most available at the end of the day. How can you be flexible in your communication? Consider what projects and responsibilities are appropriate and beneficial to youth based on their age and developmental needs. Consider how parents might need to be involved. Make sure young people know how their input is going to be utilized. And finally, offer incentives. We talk a lot about having food at meetings, right? But think about what other incentives would be meaningful to youth or would facilitate their ability to participate in this work. Now I'm delighted and grateful to turn it to Selena to share a little bit more about resources and opportunities available to you in this space.
Thanks, Emily. Within the work that the School-Based Health Alliance does around youth development, we like to focus on both the work that is directly for young people and advancing them as leaders by fostering connections, as well as helping those of you in the field who are those youth workers to support them. And so we do that in a variety of ways that are outlined here. And for each of them, there is a link that you can follow or an email for follow-up that you can learn more and connect with us. So if any of these resonate with you, please feel free to explore more and connect with us to learn how you can get involved or how we can support you in continuing this work. It all starts with our website, where you'll see an outline of all the initiatives and resources that we have available, as well as our youth-focused website, our Youth Health Hub, which was created by our Youth Advisory Council and informed by young people across the country as a space to share the work that they're doing and to be able to connect with each other, to see what opportunities are available, events, articles, as well as connecting monthly through our digest, where again, you as youth workers and allies to young people as leaders can promote your upcoming event, showcase the work that's happening in your communities, learn about important health topics and interest and information from youth, as well as the work that our Youth Advisory Council is doing. And for those looking to either start or advance the work that they're doing as it relates to youth development and are wanting more of an intentional focus, we do have consulting services available where we can walk with you through starting up a youth advisory council or thinking about how to engage them better in your planning process and engage them in the work around evaluation of the health services and centers and experience, all the way to just being able to understand the core and key concepts of youth development. And on the next slide, you'll have access to a nice QR code to make it easy for you to access our site, as well as connect with our Youth Advisory Council and all of the great work that they're doing on social. And again, connecting with us at youth development at sbhforall.org.
Thank you so much, Selena. The last, but certainly not least partnership we'll talk about today is partnerships with those in the community. We have talked about the role of the school and the health sponsor in planning and implementation. We also recommend that school-based health centers have a planning group, which will evolve into an advisory committee once the school-based health center is up and running. The planning group will include many of the folks we've already talked about: health sponsors, school staff, students, parents, and families. We also recommend inviting youth-serving organizations, healthcare providers, and community members like faith leaders into your planning group. The group might help the school and health sponsor understand community ideas and concerns about the school-based health center. They might be part of vision and mission development, help with marketing and outreach, assist with collecting and understanding feedback from students, families, and school staff, They can advocate for school-based health centers and work on fundraising. When we get to this slide, I often think of a school-based health center that we worked with. This was a team who had started a number of school-based health centers in a suburban part of their service area, and they built a strong relationship with a school administrator in a rural community. This person was really excited about school-based health. The team brainstormed a great list of community members to engage in a planning group, and for a handful of reasons, they did not end up pulling the group together. After their second year of operating, the person leading the process shared that their biggest lesson learned was the importance of creating a planning group. They didn't know what they didn't know, and if they'd had input from people outside of their organization, they may have been able to anticipate some of the hurdles they faced. On the next slide is a list of some examples of community agencies that you might partner with. Medicaid managed care organizations may partner with school-based health centers to remove barriers to well care visits for children who are past due. For example, I think broadly speaking, if you're unsure about how you might partner with an organization in your community, start a conversation about the needs of the children you serve and what your team and what their team can bring to the table to better meet those needs. We're going to switch gears, switch cogs, and talk now about sound business model.
Thank you all for that really good overview of strong partnerships and the importance of fundamentally planning together. With that, we will talk a bit now about the sound business model cog. So why is analysis of financial standing so important? And it all boils down to you have to be able to keep the lights on to continue serving students. Think about what it will cost to operate a school-based health center. How will the expenses and revenue be different from operating a community-based health center? And one way to look at the cost is ensuring the school-based health center has its own cost center and using a business plan and pro forma budget. And we're going to talk a little bit more about that. But first, let's talk about how school-based health centers are funded nationally. And Emily alluded earlier that most school-based health centers reported funding from third-party billing as well as federal funding, and you can see the other breakdown. And a diverse portfolio means that the school-based health center relies on a mix of predictable funding sources, including billing revenue, grants, and in-kind partner donations. Purely relying on grants is not a sustainable option because when that grant goes away, so do the services. So when you think about billing infrastructure and the ability to bill health insurers, it does require significant time and resources. Some states exempt school-based health centers from prior authorization requirements as a way to reduce barriers to assessing health care and to simplify Medicaid payment. In states where prior authorization is mandatory, school-based health centers should establish partnerships with primary care providers to streamline that process and ensure that you can receive Medicaid reimbursement. And if prior authorization is a barrier in your state, you can explore examples of effective school-based health center Medicaid policies on our website to see what works in other states. So with that, let's think a bit about your business model. And it's really important to consider the significance of sustainable business practices. And official national school-based health center business measures don't exist. However, the measures displayed on the screen are vital, common indicators and really observed in school-based health centers nationwide. When you look at the school population enrolled in the school-based health center, you will find that consents often correlate buy-in and those partnerships that we just talked a lot about. A practice tip is by the end of year one, you should have about 50% or more of students with a consent that is registered to use the school-based health center, and 70% or more by the end of year two. I often see high-performing school-based health centers have consent rates above 90%. When you think about utilization, a common goal is at least 50% of the consented students will have a visit to a school-based health center. And a practice tip that we see is when you see a student once, you'll likely see them again, and on average about 3 times a year. You will see a simplified data report as one of the measures, and Catherine's going to talk a bit more about that in a few minutes. While A business plan may seem like a long, gruesome process. Completing a business plan helps ensure us that all the components are in place for being able to continue to serve students. A business plan includes things such as a need statement, the vision and mission, your staffing, your facilities, your marketing and outreach, and a pro forma summary. Many of these written components can be used as you look to write grants and develop presentations to potential funders and community partners. You are likely familiar with pro formas, but simply stated, they're used to project school-based health center expenses versus revenues. When creating a pro forma, one practice tip is to recognize school-based health center specific differences. In particular, a school-based health center may see fewer visits per day than in other type of settings. So when projecting your numbers, account for the productivity variations due to staff time for outreach and engagement, extended time spent with students when parents aren't present, the coordination with parents that is necessary, and the in-kind contributions like space and utilities. Also consider the impact of the time spent engaging students in things like providing feedback on your school-based health center, youth-led outreach, and a youth advisory council and peer education. Next, we're going to transition, and Catherine's going to talk a little bit about high-quality practice.
Thanks, Paula. This is one of my favorite parts to talk about, is the fact that this is one of the cogs that makes the whole world spin here in school-based health centers. Is as long as you have your partnerships, your sustainable business models, you still have to have high quality practice to be sure that you're using evidence-based tools, that you're providing students with the highest quality of care you possibly can. And this is part that engages your quality improvement work. Are you looking at what your data is among your population at your school-based health center? Are you looking at how you can improve it? Are you messaging that with the people that you're working with your strong partnerships? And so that all kind of comes back to the importance of demonstrating your high quality practice and showing that you're there meeting students' needs. And so part of the way that we do this at a national level is through the national performance measures. And I think that the best part of this is the fact that these were national performance measures that didn't exist until the field selected them. We worked with 90 content experts to prioritize measures, to pick out measures that were sensitive to school-based health interventions, that were important to the SBHC field, that were feasible for data documentation and reporting, and were usable to providers, families, educators, payers, policymakers, the whole world of people involved in school-based healthcare, and that had meaning in terms of quality improvement and advocacy. So you will see here, after all of that process, we settled on a target of 5 national performance measures that are all put in the context of a denominator of students who you are serving in the context of your school population, of your school-based health center. So we are looking at making sure that as age appropriate, every child receives a well child visit, whether it happens at the SBHC, at a community location, or through another provider, that they receive a risk assessment, that there's BMI screenings, depression screenings, and chlamydia screenings, all as appropriate. And we do know that there are some changes going on, and right now these are not changing, but we do stay up to date on measures that are moving in and out of favor. So more to come on that, but those are our national performance measures. And that's kind of how we look at performance at a national level, and how we answer one of the questions that is, what services do students receive from school-based health centers? I talked earlier about census and telling you how SBHCs operate, how they're offering services to students, but this is the flip side, right? This is what services do students actually uptake, and answering these national performance measures helps us tell that story. And so we do that through a national data collection, our second data collection initiative, in addition to census, which we call quality counts. As this, we encourage all SBHCs to adopt the standardized national performance measures, to report performance measures data through quality counts annually, and to engage in continuous quality improvement practices. None of this is meant to be punitive for our SBHCs. It's all meant to be like looking at, what are we doing well? How can we improve? And what can we do to make sure students are receiving the best care possible? And we tie that back to, yes, these are important 5 measures, but we know that there are other measures that are important for demonstrating the impact of school-based health centers. And a lot of those have to do with education measures. And when we talk about knowing the same language, what are we talking about in terms of measures that are important to both people? So some other things that we've seen SBHCs measure is seat time and absenteeism. A student user survey, so looking at what do your users say about using the SBHC? What is their satisfaction with it? Asthma medication ratios, school required immunization statuses. Are you, as an SBHC, helping make sure that every student can be in school because they have any required immunizations? And doing social determinants of health screening. We know that almost all SBHCs are working outside of just providing direct clinical care. They're helping students and families enroll in Medicaid. They're connecting students with health, with food support services. They're doing all kinds of things to provide those wraparound screenings. There's a lot going on that SBHCs are doing. So we can move on and talk about data analysis and working with partners. Earlier, Paula mentioned the importance of a monthly report to empower staff, and that an SBHC needs to have its own cost center to track its revenue and expenses. The SBHC revenue may be considerably less than the health center's overall revenue, but we want to know, why is a cost center important? And we had someone in the chat earlier say, well, my SBHC provides services to students, to community members, to students from other schools. Kind of how do we tie that all back, right? Well, we love that. We know that many SBHCs provide services to their larger community, but we need to know what services are key to the school-based health center, and that helps do that. So how do we do all this? Do you meet regularly? Do you keep your partners up to date? What are you sharing? Are you working together to communicate what is the impact you're having on students? And that's really this all comes back to, is making sure you can isolate your school-based health center data so that you can demonstrate your impact and build stronger partnerships. And with that, I will turn it back over to talk about state level resources.
Right. Thank you, Catherine. So when we think about state level resources, it's really important to frame that the School-Based Health Alliance works closely with states since our organization's inception. And we work together really to create opportunities for expanding the number and quality of school-based health centers. There are 2 partners that we want to talk about today: the state affiliate, which is a nonprofit voice of school-based health centers, and the state program office, which usually is the governmental agency responsible for oversight of the school-based health center. The state level organizations exist to support school-based healthcare at the local and state levels, and they're a great resource for you as you work in this area. We're happy to connect you to work that's happening in your state. One example of how we work together is through our National State Policy Survey work, where we identify innovative examples of state-specific changes that help school-based health centers. We can then share these examples with other states to use as they start conversations around opportunities to remove barriers in accessing care. For example, in West Virginia and North Carolina, they were able to waive Medicaid prior authorization for students accessing care at their school-based health centers. Whenever we talk about state affiliates, we have 25 states with state affiliates, and we're working with 17 other states. To become an affiliate, you go through an application process, which we can share more with you if you are interested. 19 of our states have a state program office. And within that, most often the state program offices oversee the school-based health center in their states. Both the state program office and the affiliate play a critical role in being able to tell the story of the school-based health center. And that's one way that this happens, is through your participation in the national census that you heard Catherine talk about. And the census is really critical in telling your story, as demonstrated through federal funding and appropriation. So let's take a quick look at that. Although school-based health centers were federally authorized for many years, they didn't receive funding. And in 2021, we worked together at the School-Based Health Alliance with state affiliates and state advocates to communicate with congressional officers, to tell the story of school-based healthcare and the impact on students. And the result of that joint work resulted in our first appropriation of $5 million for federally qualified health centers sponsored school-based health centers. And in subsequent years, appropriations increased. And this year, the funding is to be determined. We do want you to know that we have always asked for funding for all sponsor types, and we recognize the importance of all sponsors, and we will continue to fight for that. If your state has either or both state organizations, make sure you know who they are, they know who you are, and that you're counted in the national census, because when we bring all of our voices together, we make things happen. Thank you. Let me turn it back over to Shamika.
Thank you, Paula. The School-Based Health Alliance is excited to share with you some of our resources, including upcoming learning opportunities, toolkits, checklists, and more. Beginning in January, we will offer a School-Based Health Center Startup Learning Collaborative. The Learning Collaborative is to support partnerships between healthcare organizations and schools to provide or expand access to primary care and behavioral health services in schools. Applications for this Learning Collaborative are due November 16th, and please visit the School-Based Health Alliance website at sbhforall.org for more details about the Learning Collaborative. Next, in partnership with Prevent Blindness, the Association of Clinicians for the Underserved, and the National Association of Community Health Centers and the School-Based Health Alliance, we will host an Eyes on Access Children's Vision and Eye Health and Community Health Centers webinar on November 1st, 2023. To learn more about this webinar and to register, please visit the link that is included in your PowerPoint slides, and you may also visit the School-Based Health Alliance website to learn more details. Both the Learning Collaborative and the webinar are provided by our award from the HRSA. Emily?
Thanks, Shamika. A couple of free resources. This infographic situates school-based health centers within the larger context of school health. On the next slide, we have a planning checklist, which outlines many of the steps that we've talked about today, as well as some other more granular considerations for school-based health center planning. We also have a number of toolkits and more robust resources. The ones on the left are sort of fundamental to school-based health centers. The ones on the right represent some sort of topical and more specific areas of content. I think that Paula may have mentioned this earlier, but in addition to many of the learning opportunities that we've shared, the School-Based Health Alliance offers individual consulting for school-based health center planning groups at the local level. We work with schools and school districts, healthcare organizations. We also work with funders, researchers, state level stakeholders, as well as national level groups. So happy to chat more. You can email us at info@sbhforall.org with questions. I am going to launch our evaluation poll. Again, these questions are really helpful for our ability to understand the impact of our work. If you're able to take a couple of moments and share your feedback, that's valuable for us. We know that we did not get to all of your really wonderful and detailed questions today. Please feel free to reach out to us at info@sbhforall.org. We would love to connect more. We will send the slides, recording, and resources. And we are just so appreciative, one, that you joined us today, and two, of all the work that you do to support children and families in your communities. Thank you so much. Bye all. Thanks, School-Based Health Alliance team.